The main function of the axial skeleton is protection. It is composed of 80 bones, which make up the skull, the vertebral column, and the bony thorax. The skull itself has a total of 22 bones, most of which are flat, and most of them are fused together by immovable sutures. The skull can be divided into two parts. The part that is encasing the brain is called the cranium. In addition to protecting the brain, it also provides attachment for neck and head muscles. There's a total of 8 bones that make up the cranium: 2 parietal, 2 temporal, 1 frontal, 1 occipital, 1 sphenoid, and 1 ethmoid. When it comes to our test for this unit, you will not need to label those bones on a diagram. However, you should know that there are 8 of them, and the names should at least be familiar. So if you hear temporal, you should know that we're talking about one of the cranial bones. The other part of the skull is made up of facial bones. The facial bones provide a framework for the face, sense organs, and teeth. Teeth are not bone. Teeth have their own unique structure, so those are not considered to be bones. The facial bones mainly anchor facial muscles, and there are 14 different bones. Many of them are paired, as you can see on the list. There's only 2 that are unpaired: the vomer, which forms the nasal septum, and the mandible, which forms the lower jaw. Similarly to the cranium, you will not need to be able to label all of those 14 bones on a diagram, with the exception of the mandible. You definitely should know where the mandible is on a diagram. The other interesting thing about the mandible is that is the only movable joint of the skull, which allows us to eat and then talk as well. This is just showing a visual of all the different bones that make up the skull. So the paranasal sinuses are also found with the skull, and they're actually found within facial bones. There's 4 paranasal sinuses, which are hollow air-filled spaces that are surrounding the nasal cavity. So again, you're not going to need to know the specific names and locations of the different paranasal sinuses, but you should know in general where they are located. The sinuses are lined with mucosal tissue, and it's continuous with the nasal cavity. So as air enters the nasal cavity, that air can also enter the sinuses. As mucus drains out of the sinuses, that mucus can then enter the nasal cavity as well. The main functions of the sinuses are to lighten the weight of the skull. The skull, if all the bones were solid, would be extremely heavy and difficult for our cervical vertebrae, our neck, to hold it up. So it lightens the skull. It allows air that is inhaled to be humidified and heated, because we want the air heated and moisturized before it ends up in our lungs. And it contributes to the resonance of voice. So the shape and the depth, basically, of the sinuses cause your vocal sound waves to actually reverberate inside them, which then adds to how your voice sounds to others. The sinuses can get infected, and that's when you have a sinus infection and you might have tenderness on those locations of your face. Oftentimes, you can tell the difference between a sinus infection and just a regular cold, because the mucus that's draining has more of a fluorescent yellow or greenish color to it. Other bones of the head: one is the hyoid bone, And this is a bone that's very difficult to locate. You can see it on skeletons, and so you can see it highlighted in yellow on the diagram on this slide. You may be able to feel it if you find where your voice box is. If you put your hand in front of your throat and you can feel that hard cartilage of your voice box, find the top and kind of squeeze inward, and you may feel the hard sides of the hyoid bone. It's between the mandible and the larynx. Its job is to anchor the tongue. So it's providing like a base for the tongue, which is a muscle we use very often. And it's the only bone that does not articulate with another. When we say articulate, we mean that the bones are somehow connected so that there's able to be movement. This bone appears to kind of just be floating out there, and it is attached to ligaments to hold it in place, but it's not really attached to any other bone itself. And then we have the auditory ossicles, or the three inner ear bones. Those are called the malleus, incus, and the stapes, or the more common names are hammer, anvil, and stirrup. So as sound enters the auditory canal and it causes the eardrum to vibrate, that also causes these three bones to vibrate. And that helps to transfer the sound wave vibrations into the inner ear, where all of the electrical signals are generated to send messages to the brain. Moving on to the vertebral column. The vertebral column is providing protection for the spinal cord. The general anatomy of an individual vertebrae, there is a very thick body. There is an opening called the vertebral foramen. That is which the spinal cord ends up traveling through. On the posterior side is a spinous process. If you have seen someone bend over and you see these kind of spikes coming out of their back, what you're seeing through their skin is the spinous process of their vertebrae. And then there's also a transverse process coming off of the side of each vertebrae. The processes are there to help with muscle attachments. All of the vertebrae in the vertebral column are separated from each other by intervertebral discs. These have a fibrocartilage structure. So the outer layer is the annulus fibrosus, and that's very tough. The inner part of the intervertebral disc is the nucleus pulposus, and that's more like a gel-like substance. And then there's also the end plates that actually are in contact with the vertebrae. The functions are to allow slight movement between the vertebrae, and it's also a shock absorber for the spine. If there were no intervertebral discs and the vertebrae were just stacked upon one another, they'd end up locking in place, and then we wouldn't have any movement of the vertebral discs, and we wouldn't be able to bend down or arch our back or move from side to side. And then they also provide that support and shock absorption. So there's just an image of an intervertebral disc. A herniated disc, also called a bulged disc or a slipped disc or a ruptured disc, is when the annulus tears, and that's the outer part. And if that tears, then the nucleus, the inner part, is going to start pushing through. And when that happens, it can irritate nearby nerves and cause pain. It can cause numbness, tingling, because it's interfering with the spinal nerves that are going to and from the spinal cord. Herniated discs often increase, the incidence of them increase with age, and it can be an early sign of degeneration of the intervertebral discs actually starting to break down. So if we look at the vertebral column itself, there are 5 different divisions. There's the cervical vertebrae, the thoracic vertebrae, the lumbar vertebrae, the sacral vertebrae, and the coccygeal vertebrae. And that is how they are oriented superiorly to inferiorly. So if we start up at the top with the cervical vertebrae, there are 7 different cervical vertebrae. The very first one, the top one that is nearest the skull, is called the atlas or the C1. This is unique because it does not have a spinous process. It doesn't have that part that's protruding off of the back. And it also does not have one of those large bodies, which would be on the anterior portion. And so you can see what the atlas looks like. The next one down, the C2, is called the axis. This would have all the normal parts of a typical vertebrae. It's got the body, it's got the foramen, it's got the spinous process, the transverse processes, but it also has an extra additional part called the dens. The dens is protruding upward and it provides a pivot point for the atlas. It's believed to be the missing body of the atlas attached onto the axis. And so it allows pivoting of the head at that joint. The other three cervical vertebrae, or the other cervical vertebrae from C3 to C7 are very typical, kind of looking like the one that we saw on a previous slide. So this is just showing the atlas and the axis, how we are able to have that rotation, and that's because of the dens that we see on the axis. The missing spinous process on the atlas is what allows your skull to tilt backward. If it had the spinous process, we wouldn't have that backward tilt ability because it would get in the way. This is some extra information. This is a process called anterior interbody cervical fusion. My dad actually had this surgery done about 17 years ago now. He is a roofer and he ended up having an accident where him and his crew fell off of a scaffolding that was about 2 stories in the air. And so he ended up breaking his neck and his back and then having a lot of other internal injuries. So, one thing that they did in terms of his cervical break was they wanted to fuse a couple of the bones together so that there wouldn't be movement, which could then possibly compromise the spinal cord. So, what they do in this sort of a surgery is they take a small piece off of the hip bone and then they use that to fuse 2 vertebrae together. So this is a surgery that will happen if there is a break or other possible problems with the vertebrae in the spinal cord to prevent that extra movement. Or sometimes it might be done if the intervertebral disc is degenerating in that area to just fuse those two together so they don't start scraping on one another. So moving down the vertebral column, next we have the thoracic vertebrae. There are 12 thoracic vertebrae, and they're just named T1 to T12, superiorly to inferiorly. Each thoracic vertebrae articulates with the 12 ribs. They gradually increase in size as we go more inferior, and they allow rotation of that upper area of the thorax. Next, moving down, we have the lumbar vertebrae. There's only 5 of these. They are named L1 through L5. These have a very large body, and that's because this is kind of where our center of gravity is, and so it's going to receive the most stress in terms of the weight of the body. These are able to lock together for additional stability, so you don't really have much rotation of the lumbar vertebrae. This is just showing the relative comparison between cervical, thoracic, and lumbar vertebrae in terms of size and the shape of the different parts. This would be the body, and you can see how it gets more massive the further down the spinal column we go. And then you can see also the differences in the spinous process. So we still have two more sections of the vertebral column. The next one is the sacral vertebrae, or called the sacrum. These are 5 bones that have fused together, and they form kind of a shield that is connected to the backside of the hips. So when you look at a pelvis, this is not part of the pelvis itself, but instead it's part of the vertebral column that then attaches to the pelvis. So it's one solid structure because the bones have fused together. And then the final division is the coccygeal vertebrae. This is the coccyx, or the tailbone. This is made up of 4 fused bones, and these, as I said, are fused. And so they are 4 individual bones that over time fuse together. Now, your vertebrae have some very specific curvatures to it. The primary curvatures are the thoracic and the sacral. Those are curved posteriorly convex, or they curve outward. And so you can see the thoracic and the sacral have the same basic curvature to it. The reason they're called primary curvatures is because you're born with those curves in your vertebral column. The secondary curvatures are the cervical and the lumbar, and those are posteriorly concave, or those curve inward. These are called secondary curvatures because you don't have those upon birth. Instead, you develop those, and you develop those as you go through different stages of development. The cervical vertebrae, that cervical curvature develops as an infant when the infant's learning to lift its head, and the lumbar curvature develops as an infant is learning how to walk. And those curvatures are actually formed through changes in the intervertebral discs between the vertebrae themselves. So then the last part of the axial skeleton is the bony thorax. The functions of the bony thorax are to provide a protective cage for the heart and lungs. It supports the pectoral girdle. It has muscle attachments, and it aids in breathing. So this is protecting the heart and the lungs, which we know are extremely important structures. So if they're so important, you would think that they should have a solid bony covering, kind of like the brain does with the cranium. However, the thorax needs to have flexibility to it because of breathing. And because of that, there is openings in the thorax, and then there's also cartilage that attaches things together to allow your rib cage to expand when you're breathing in, and then to go back to its resting position when you breathe out. So the sternum is actually made of 3 separate bones that have fused together. It almost looks like a necktie, where the top manubrium would be like the knot in the necktie. The body would be the main part there. And then at the very end, there's a small tip that's called the xiphoid process. For those of you who are certified in CPR, when you're doing chest compressions, you need to make sure that you're placing your hands over the body of the sternum. If you place your hands too far inferiorly and it's over the xiphoid process, there's a risk of every chest compression causing that xiphoid process to go into the liver and lacerate or cut the liver with each chest compression. Sometimes that happens. Sometimes the xiphoid process can even break during chest compressions, but that's kind of a triage situation where getting that person, their heart pumping and their circulation going at that point is the main concern. rather than the possible damage that could happen to the liver if those chest compressions are done incorrectly. The ribs, we have 12 pairs. Remember that each pair of ribs attaches to one of the thoracic vertebrae. The ribs can be divided into different parts. The true ribs, or the vertebral sternal ribs, are the top 7. The reason they're called vertebral sternal is because they have attachment on the vertebrae posteriorly, and then they are attached to the sternum via costal cartilage in the anterior. So each rib has its own costal cartilage attachment. So those are called the true ribs. The false ribs are ribs 8 through 12. And those ribs can be further subdivided into the vertebral chondral ribs. Those would be ribs 8, 9, and 10. They have vertebral attachments posteriorly, and then in the front, anteriorly, they attach indirectly to the sternum. So they have cartilage that attaches to the cartilage of the vertebral sternal ribs. So they themselves are not attached to the sternum, they're attached to cartilage instead. And then the last two are the vertebral ribs or the floating ribs. Because they have only vertebral attachments posteriorly, they have no anterior attachments.